Hi, I'm Dr. David Hill, and today we're going to talk about treating intestinal parasites in children. Now, there are a lot of different species of intestinal parasites that can affect children, and most of them are harmless. Children in underdeveloped countries and even developed countries may get intestinal parasites from time to time, and no one ever knows about it. There are, however, some intestinal parasites that do cause some problems. Longworms, roundworms, things like strongyloides, ascaris may actually cause intestinal obstructions. I've seen a case of appendicitis associated with intestinal parasites, which required surgery. So children who present with unexplained vomiting, abdominal pain, or even actually seeing worms when they use the bathroom should definitely be evaluated by a physician. The physician can send a stool study to the lab if he or she is worried about intestinal parasites. The lab will look for things called ova, which are the eggs, and of course live parasites themselves under a microscope in a study called an ONP. Usually you need 2 or 3 ONPs to be absolutely certain that there's not a parasitic infection if one is suspected, because you can miss one on just one sample. If your child is determined to have intestinal parasites or to be likely to have intestinal parasites, the treatment tends to be very simple. The parasites usually have a life cycle where they lay eggs, have a larval stage, and an adult stage. Many of the medications don't affect parasites at the egg stage, so the medication therapy regimens will go on usually for a couple of weeks. Sometimes it's just 1 dose of medicine at the beginning and 1 dose of medicine again 2 weeks ago, but depending on, or 2 weeks afterwards, but depending on which medication it is and which parasite, there may be continuous medication. In many cases, we assume that the entire family is infected, even if other family members don't have symptoms. In those cases, we'll treat every member of the family, not just the child who's thought to have the parasite. Avoiding parasites is a matter of good hand washing. Plain soap, antibacterial soap, doesn't matter, but make sure that children wash their hands before they eat to avoid introducing parasitic infections. Talking about treating parasites in children, I am Dr. David Hill.